We know that we're struggling with a healthcare system that doesn't have enough people, enough hours, enough resources to meet the basic needs of Canadians. Sick notes are unnecessary, and we should be doing everything possible to eliminate them.
If you're feeling under the weather and want the day off of school or work, you'll probably be asked to get a sick note from your doctor. But with the healthcare system that is strained and many healthcare workers experiencing burnout, the Canadian Medical Association is hoping research they put out will stop this practice.
From the data that we released just recently, we know that 1 in 3 Canadians have had to generate a sick note in the last year. If you look at the number of hours that translates to in offices like mine, I'm a family physician, that's 12.5 million unnecessary healthcare interactions a year. If we want to try and free up unnecessary administrative burden so that we can reduce our burnout, improve our efficiencies, and really not contribute to spreading viral illnesses.
Dr. Ross says the time spent on sick notes doesn't just take doctors away from patients, it also adds to their burnout, leaving them with little time for their own well-being, and that employers and schools need to think of an alternative method.
So we have to acknowledge out of the top that sick notes have never really been shown as an effective method of managing absenteeism. Sick notes are not a health system issue. They really are a human resource issue. And we understand that organizations have that need to manage their HHR and absenteeism, but physicians simply no longer have the time to serve as a gatekeeper for sick notes for those short-term minor illnesses.
Workers in Ontario can now take up to 3 days of sick leave without a doctor's note, thanks to new legislation passed on Monday. However, under Bill 190, employers can still request other forms of verification, like a self-declaration or a receipt for over-the-counter medicine. In Toronto, I'm Brandon Rowe for City News.